So today we have Dixon Galvez visiting us to talk about webpage design, visiting the Northern New England Physicians for National Health Program summer internship.
Thank you. Yeah, and so we were just doing introductions quickly, and people were talking about their experience with website design and their interest in, um, how to design and how to get the word out about sites that you're building. So if anybody else wants to, go ahead and do that, then I'm curious to hear what other folks' interest in the topic is.
So Ariana and then Natalia.
Oh, I think Natalia said she was out in public right now, but just joined the recording. But
Thank you.
no problem. But hi, Dixon. My name is Ariana. I'm a rising second year at Rowan Virtua SOM, and I have very little website experience. Or web designing experience. I took one course in high school and don't remember it. But I'd be interested in hearing more about the building of the website, as well as I'm interested in what Trinity and Lauren pointed out of how to get people to your website, but I'm probably at a more amateur level than they are.
Thank you. And Caitlin?
Hi, I'm Caitlin. I am also a rising second year at Rowan Virtua SOM in South Jersey. And like Ariana, I definitely have a very limited to no experience with website design, but I am very interested in learning more about it. Specifically, I know how important, an attractive UI and an intuitive website can be, especially when you're trying to get people to visit your site and want to stay on the site. So definitely I know it's a very important tool with advocacy and getting kind of a message out there. So I guess specifically I'd want to kind of listen to your reasoning and the way you laid out the PNHP website and how to tailor a website design for advocacy specifically, so for that kind of audience in mind.
Thank you. Thank you. So Dixon, do you have an idea of how you want to organize it since I sent you some of those questions in advance, or would you like me to just start asking questions or guiding you with the list that they gave us?
Sure. So I do have a number of examples that I can share. So if I'm able to share my screen, then I can go ahead and kind of run through those. And, you know, we can talk about, kind of the design elements that we put in for the PNHP site and some other sites and some other examples. So I was going to talk through those, and if at any point people have questions or want to interject or see something else or different from the sites that I'm going through, please do. This can and should be interactive. If folks don't have any questions during the time that I'm sharing the examples, then we can get to those afterwards. I'm also logged into the back end of our various sites, so if people want to see some of the tools that we use, then we can do that as well.
Thank you.
All right, so I will go ahead and share my screen. And before I do that, so my name is Dixon Galvez-Searle. I'm one of the communication specialists at PNHP at the national office. And my areas of responsibility are digital media. So essentially ones and zeros, anything having to do with our website. We have a few websites. Anything having to do with our social media, our email communications, also our design work. So our web presence in general. And I will go ahead and share my screen. And you all should see the PNHP homepage here. All right. Okay. So what you're looking at here is the PNHP website, pnhp.org, and you're seeing a big pop-up window here in the middle, right? We usually do have a pop-up on our website, and it is geared towards whatever the most pressing PNHP priority of the moment is. So this is our moral injury project. We are looking for people to fill out a survey that we've put together. The deadline for that is the end of July, so it's especially pressing at the moment. We want people to fill out the survey. We want people to learn more about the project by going to our landing page. If people have filled out the survey, we want them to share it with their colleagues. So this is a big priority at the moment. When we open up registration for the annual meeting later this summer, we will have an annual meeting pop up. So,
Dixon,
yeah,
is it possible to like have your pop-up know to not pop up? Like if a person's already registered for a meeting, it's kind of annoying to have this, like have to do the extra clicks every time you open up the page again.
yeah. So we have this set to disappear for 24 hours when somebody X's out of it. We also have it set to not appear on the moral injury page itself. So if somebody goes directly there, they don't need to see that pop up because that's the page it will take them to.
Yeah.
But we're not able to target at whether somebody has filled out the survey because that's going to require sort of knowing whether they've gone to the third party platform where it's hosted. And so we don't have that capacity within our WordPress setup. So we X out of there and we get to the home page. So one thing that I think you'll see on the PNHP site is there's a lot going on, right? PNHP is a national organization with a 35 plus year history, 25,000 members across the country, chapters in most every state, multiple chapters in some states, active members doing all sorts of different things on all sorts of different topics related to Medicare for all and healthcare more broadly. So we have a lot to talk about. We also have multiple ongoing priority campaigns. So the moral injury project that I just mentioned runs alongside of the Medicare for All bill that was launched earlier this spring that we want to be talking about as much as we can. And that runs alongside our Medicare Advantage campaign, which we want to be talking about as much as we can. And we have, more things coming up in terms of a Medicare Advantage equity report that we're working on. So at any given point, we're going to have big priorities and probably just a small number of them, which will feature prominently. But we also have a lot of archival materials. And sometimes members will want to access that. So you're going to see more in the menus up here than we might recommend for a website that has a more streamlined focus. And there's a lot of advantages to that. But when you get into kind of this volume of information that you want to share, then organizing it is really, I think, the biggest priority. What goes front and center? So we have this carousel of images at the top. It has our biggest priorities. So we're talking about, I will just go to the first one here, about PNHP. If somebody's coming here for the first time, we want them to know who we are and what we're all about. The moral injury campaign and moral injury project is our second image on that carousel because we really want people to take this survey. It's part of a grant that we're working on that goes through the end of this year. Our annual meeting materials from the last year. This is our big event for the year. And so a lot of work goes into that, and it really sets the agenda for the coming year. This was from last November, but people who attended and people who weren't able to attend, you want to be able to see these. Then we have our Medicare Advantage harms report, which is a page that I'll show you quickly, just to give you an example of one of our interior pages. This was a PNHP generated report that we worked on for quite a while, and is a cornerstone of our Medicare Advantage and Medicare profiteering campaign. So we really want that to be front and center. And then an explanation of what is single payer and an invitation to join. So that's a lot of stuff going on. If you scroll down, you'll see some of these things are repeated, right? So this is the first one is the PNHP physicians proposal for Medicare for All. That is sort of an evergreen thing that we want to feature. That's PNHP's flagship proposal for single payer. So that's always going to be featured prominently. Then underneath that, we have the Moral Injury Project. And then underneath that, we have sort of our rotating news ticker as our members and leaders are featured in the news or are doing writing, getting quoted in news articles or publishing op-eds or letters themselves. We'll feature that here. This is all chronological. Health Justice Monitor is a blog that friends of PNHP write. And so we post those whenever they're published. Then below that, the harms report that I mentioned earlier, the latest piece of Medicare for All legislation, and then a call for medical society resolutions. And then there's some chapter stuff. People can find their local chapter. Each of these is clickable. People can see what the latest news on their state is, and get in touch with people from their state. People can sign up for emails.
I'm just gonna comment right here, as
Yeah.
far as like when you're designing things, I really find it convenient to like, oh, scroll down to the first page and click on the state if I'm looking for like, who should I reach out to if I want to talk to somebody in Utah or whatever, right? And so to have it be consistent that like I can always, it's been like this for years, I can count on it. It's easier for me than, oh, okay, finding the menu about and then chapters and then, so some consistency and convenience for the viewer is helpful.
Yeah. And so I think what you're seeing here is there's a lot of information, right? PNHP at the national level is regularly doing things. Our members at the state and local level are regularly engaged in campaigns. So we have a lot that we want to talk about. And adding that to the site is important. So this is the homepage, which is the most trafficked page on any website. And we've tried to lay that out in priority order. So the most important things are at the top, and then it goes sequentially as you scroll down. There are also some things here in the menus which are more evergreen. So like under member resources, for example, you see 2024 annual meeting materials. That's a timely update, but you're also going to see a full archive of our newsletters. You're going to see our slideshows. These are updated regularly as we have new things to share, but it also includes archival things, materials and handouts, in case people are looking for that. We have an archive of webinars, and an option for people to join and renew.
Dixon, how many of those things are password protected? I know the slideshows are. Is anything else password protected?
The newsletter is.
Oh, okay.
Yes.
Is that anything that any interns want to learn more about? No, okay,
Yeah, we have some pages password protected, not many, but since those are a benefit of membership, we put those behind a single password and send it out to people when they become members. And it's fairly easy to set in WordPress. So on the page itself, if you were to go in and edit the page, you can set the password. All right. So the main point being, a lot of this is newer information, and we try to put that front and center. And then we have sort of evergreen information like about single payer, what is single payer, how do we pay for single payer, what's our physician's proposal. And we try to make that it's not front and center on the homepage when you come to the website, but it's something that members and anybody navigating through the site should be able to find without digging too deeply. So
and
that,
Dixon, under about single payer,
yeah,
if you, yeah, if you see the Medicare for All Act of 2025, so that is, he says evergreen, but every year he's also gonna, every 2 years he'll update that with a new one. But if you click on that, he's got it arranged in a really convenient way that you can find summaries as well as a link to actual House bill and actual Senate bill. So he's got it all organized. It's like one click and you can see all these resources.
yeah. And this is sort of an example of what a lot of our internal pages look like. Again, because we are a policy and advocacy organization, we're going to go into a little bit more depth on our web pages than a lot of sites might. There are websites where it's totally appropriate to have very short web pages, with quick calls to action. And PNHP, you see, there are a lot of links here. There's a lot of information. There's a lot of kind of different categories, suggestions for activism, links to videos, graphics that we posted to social media. So this is kind of the comprehensive, here's everything you might need to know about this bill page that we want as a reference for members to kind of dig in and advocate for this. I'll show you really quickly the page that we have for the harms report that we put together, so this is a report that PNHP worked on for a number of months and launched in the spring of 2024. And it essentially is, a research document that PNHP put together. So this is lengthier. There's a PDF version as well, but the web version has all of these different sections that people can go through and see all of the different ways that patients and providers are harmed by Medicare Advantage insurers. So people can navigate the table of contents that way. But just to scroll through and kind of give you an idea, you're seeing this is a lengthier report, right? There is also some video interspersed here. So we talked to a number of people as we were developing this report. So we would have narratives that brought the research to life. So all of the research that we did and all of the categories of harms are illustrated by people telling specific stories. So, someone's telling a story about trying to access dental care under their MA plan, or, being listed in a ghost network when they were not in fact part of that network. And so you'll see, this is just sort of the way it's organized. This is a big web page with a lot of information. I do think it's important to have this table of contents at the top so people can see what they're getting into as they look at this. and sort of poke around and navigate. If someone were to click on excessive costs, for example, like, oh, I'm interested in that, then they can go right down to that section. So that's sort of the approach for the PNHP site. Again, it's a fairly dense site. There is a good amount of information. We try to put whatever is current up front. One thing I want to stress is that this site and any site does not live in isolation. So when we put the harms report together, for example, we did a big launch and we communicated about that through all of our communications channels. So, we had a webinar to launch the report, and we did a whole lot of recruitment to try to get people to sign up. So we were sending emails to our members. We were also, calling and texting our members. Our members were calling and texting other members. So there's a lot of offline work that goes into getting people to look at your website. And especially with this harms report, this was a big priority for us, and we wanted a lot of people to see it, and we wanted a lot of people to share it, and take action based on what was in that report. And in order to do that, building the page is one thing, but there's a whole lot of work that goes into directing people to that page. And a lot of that is happening outside of your website, right? So we can do things like Google Ads, and social media posts and social media ads, to push people. We do have a large membership, so we can get people to sort of send the link to folks and publicize the launch event and publicize the report itself. We have an email list where we can send the link out to people, but I think even absent all of that, or not having those sorts of things at that scale, there are smaller things that you can do, right? So even if you're putting together a site to try to recruit members for your local Snap chapter, um, the there's a lot to do outside of that. So you might put together a very small site or even a link tree, or you might have a social media profile that you want people to visit and like, or follow. But the work of doing that is, designing it and making it, you know, uh, easy to navigate and inviting. But also all of the outside stuff, right? Talking to people one-on-one, saying, hey, have you seen this? Incorporating it in, um, like QR codes or business cards that you're, handing out to people. Incorporating it in handouts that you might have if you're tabling. And then, if you don't have a large email list like we do through, kind of a dedicated program, people have, their individual contacts, right? And they have ways of getting in touch with fellow medical students at your school. So, um, think about the channels that you can use, because it's largely going to be channels outside of the website itself that you're going to be using to drive people to the website. And that's such a big part of making sure that this thing is useful, because building it is one thing, but driving people to it is an even bigger part, and something that is not going to get taken care of on its own just by virtue of having a website, even if it's a really nice one. So this is the PNHP site. Lots of stuff going on. I did want to highlight a site that we put together for our Medicare Advantage campaign specifically. And this is a lot more streamlined, right? So this is healmedicare.org. And you can see there's just a handful of links here at the top, right? Learn more, take action. This is the home page. There are two things in the carousel. And you scroll down, there's a few specific calls to action. We want people to sign a petition. We want people to take our survey. We're giving people resources to meet with their representative. This may have disappeared. There should be a video here. Let me try reloading the page. I know there is. Sometimes it doesn't show up correctly if I'm logged into WordPress. So let me log out. And try just going to the website, not logged in. Okay. Yeah, so video, large photos, and you can see like this homepage has a lot less text. It has a lot of images front and center. It has videos that people can play. And a lot of this is really designed to push people to sign this petition. Because for this particular campaign, one thing that's a goal of ours is to get as many people on our email list as possible, particularly people who are not already on the PNHP email list, or not already familiar with PNHP. We're reaching out to people who are on Medicare, maybe on Medicare Advantage, senior groups, retirees, retired union members. And so we want to present this one issue, what you should know about Medicare Advantage, sort of standalone. So it's a little bit more streamlined. There are some internal pages here in terms of like education and kind of what we have to say about MA, and then action steps that people can take, again, meeting with your rep, signing our petition. If you go to the sign our petition page, which is something that we feature the link to quite a bit through the website, you'll see it's embedded directly in the site. And there's not really anything else here other than the petition. So a lot of the pages here on this site are shorter. This one, which is about Medicare Advantage messaging and how we talk about this issue, it's got a webinar that we did so people can watch the recording. It's got a link to a one-pager. It's got a suggestion that people write a letter to the editor. So for sites like this that are kind of focused on a single campaign, we really want to be in and out, right? These pages, these interior pages and the home page as well, are going to be a lot quicker and easier to scan. And oftentimes they're going to direct to kind of a single call to action. And so for this site, that is sign the petition. And so we say that kind of over and over and over again. And so that is another approach that I think, can be appropriate for a lot of sites where you're thinking about kind of what is our one campaign or our one ask that we want people to do. Out of that. Even more streamlined than that would be just having a link tree. And that's a totally legitimate way for you to organize things, right? So, if a Snap chapter, for example, has a link tree with some resources that you want to link to, maybe a registration for your next meeting, maybe minutes from the last meeting, then you can do that and set that up very quickly. This is one that was put together for the Medicare for All resolution effort in Arlington, Virginia. And you can see, they have this link to a May 31st event up top. And they have a petition here. They have their draft resolution, upcoming meetings. They have some blog entries. I even feel like this is maybe a little long. But so I would, if they were to ask me, encourage them to streamline this a little bit. But Linktree is a good thing that you can use to to make a quick impression. And if you want to drive people to your sort of online home and you have a specific way for them to sign up, then it's a good option. I'll show you a just a commercial version as well. So this is the link tree for a stand-up comedian. She wants people to watch her special and come to her shows, right? So she's got a link to her special and she's got her dates, and you can click on these and buy tickets, right? So it's very obvious going here, like nobody's going to spend a lot of time on this site. They're going to go here because, oh, I saw a clip of this person and I thought they were funny, and are they coming to my town? They're going to spend 30 seconds on here, but it's organized in such a way that, yeah, they can see exactly what they came for. And I think there's corollaries here for, for maybe what Snap chapters would be doing. This is the Kaiser Family Foundation website. I put it here just because this is another example of a website that has a lot to say, right? This is a news organization. It's a health policy and research organization. They are always putting out new stuff, right? So if you come here in a week, then all of these things, all of these links that you're seeing are probably going to be replaced by more recent ones. But so it's kind of like if you're going to a newspaper's website, you're seeing that day's news. But they're also organized by category. So if you want to see, information on the ACA or COVID or Medicaid, et cetera, racial equity, they have these categories. They have much more information than even the PNHP website does. So their organizational challenge is also significant. But this is kind of what it looks like for an institution where they're generating content, where they're generating research, where they're generating news stories and blog entries, like on a constant basis, on a many multiple times a day basis, and what that looks like for their site. KFF also is much better resourced than I think people in the advocacy space are, but that's fine because we can be small but mighty. I also think I mentioned Linktree as sort of a free option that's sort of outside of like WordPress or Wix development, actual website development. So Linktree is templated. This is Substack for Wendell Potter, who noted health insurance whistleblower who's been advocating for Medicare for all and talking about health policy for a number of years now. And this is his Substack, right? So he regularly publishes stuff. He has a fair amount of stuff to say, based on his time in the industry and his understanding of it, and also just based on what he's seeing in health policy. And this is, it's sequential, right? So the latest stuff is up here. The biggest one in the middle is from 4 hours ago. And then, July 8th, July 7th, July 3rd. This is kind of the standard blog format. And if you feel like this is appropriate and you know, you or your group or your chapter has a lot to say on a regular basis, Substack is a good option for that too. But again, you have to drive people to it from outside. I'm going to show you two more quick things, and then I definitely want, folks to have a chance to ask questions and explore anything, within our sites because I am logged in. So this is Zoran Mamdani's campaign website. This has a very obvious, ask of what they want people to do. So at this point, now that the primary election is done, you're going to see donate links all throughout here, right? As we get closer to the general election, you're going to see voter registration links and volunteer links and all that. Political campaign is something that has a very small number of very concrete asks. They want people to donate money, they want people to volunteer, they want people to vote for them. So again, it's very image heavy, right? You're going to see a lot of photos, you're going to see a lot of videos. You're going to get to text further down. This is where we kind of get into policy. This is even a little bit more text than you're going to see on a lot of campaign websites. But, the headlines are there. And then if people want to, learn more about any particular issue, then they have something to read. So, as somebody is scrolling through this, they might decide, oh, childcare is something I really care about and I'm interested in, so let me read more about that in particular. And then again, this is endorsements, but you're seeing a lot of visuals. So visuals, video, select text, like these headlines are short, they're colorful, they're big, and calls to action that repeat over and over again. This is in the style of, I think, a lot of political campaign websites, but it can translate to if you're thinking about an issue campaign or if you're thinking about recruiting people to, join a SNAP chapter, or if you're thinking about, circulating a petition around, around Medicaid or around any other particular local issue, or if you're thinking about, union organizing at, a particular institution, like something that has a very simple, like, ask and wait for people to get involved, like this sort of style of site can be very effective. And then I want to show you what not to do. So this is a website that was put together. Does anybody have a guess as to how old this website is? No. All right, Betty, I think you're muted.
Like 2006?
2006. It is, this website was put together in, I believe, 2017.
Oh
So,
my gosh, okay.
this is the website that the state of Arkansas put together when they implemented work requirements for Medicaid during the first Trump administration. So they got approval from the federal government to move forward with work requirements. And they put together a website that was, from the looks of it, as deliberately confusing as possible, right? So people will have to go down here to Arkansas Works, log in, report their work activities. So, it's dated in terms of the look of the site. You can tell just um, from looking at this that it's not mobile friendly as well. And also a fun fact about this, the ability to log in and report work activities shut down every night at 8 p.m. So, this was designed to kick people off of Medicaid, right? It was the people who put this website together did not do it because they don't know how to put websites together. They did it because they very much know how to put websites together, and they put a broken one together. Um, so, but you look at that and you can see like, oh, these are the things that you don't want to do, right? You don't want to make people click through multiple times. You don't want people to have to read through a whole bunch of text. You don't want 1,000 different colors and text and images and fonts competing with each other for attention. If somebody were to go to here for something that they did not need, right, they would bounce off of this site very quickly. So do the opposite of this. So that's I think I'll stop there. I will let you know that the Heal Medicare site is a WordPress site, but it's built using a plugin called Elementor that's similar to Wix and Squarespace and other drag and drop type platforms. So if people want to see specifically how that works, I can log in and kind of show you the back end as well. So
That's just the Heal Medicare part that uses that. What was the
yeah,
name of the plan again?
it's called Elementor.
I have a question. So I know you mentioned that PNHP just given its mission and how much it covers, there's always a lot of information on most of the pages you'll navigate to. When do you know kind of like where to like group things together?
So I think the two main spots that are the prime real estate for our homepage are this carousel of images at the top, and these kind of strips of images and text below them. So if something is a big priority for us, we're going to put it there. And if something is a really, really big priority for us, then we're going to do a pop-up for that. So I think, in terms of what our biggest priorities are, I mean, that's a question of, our board and our leadership and our staff are constantly talking about that and assessing that. And so, those are decisions that we like, come to as a staff and as an organization. But once we've decided, this is something we really want to put focus on, then we'll put together a communications plan that includes, featuring it prominently on the website. And I know I mentioned the moral injury project, but we're going to have a report for that later this year. And when we do, when that report launches, it's going to be prominent on the website, and we'll do all of the additional communication outside of that to make sure that people get driven to that page and see that page. But did that answer your question?
Yeah.
Okay.
Kind of sorry with that, I have another question.
Mhm.
So I know when using sites like WordPress or as you mentioned like Elementor or those drag and drop, you are given so many different options for how to kind of present your information.
Mhm.
Do you feel like you select those options based on like the type of information that you're presenting, or is it more of like a visual thing and how easily you want people to see things?
I think a lot of times it's driven by content. So for the harms report, for example, we sort of developed the format of that as we were working on the report. So the two sort of went hand in hand. So we knew that we were going to have, a fair amount of text um, speaking to the research. We knew we were going to have, a lot of references and citations throughout that we would need to link to. And we knew that we wanted to highlight people's stories. So, having doing those recordings over Zoom and um, you know, putting them up on YouTube and kind of integrating them throughout the report. Uh, it all stemmed from like the content that we were developing. And the bill, the page that highlights the Medicare for All Act, um, in a similar respect, I think anything that we develop, um, will want to share. And so I think the PNHP site, maybe more than most, um, is sort of a place to host all of that stuff, right? Um, and then the question is, how do you organize it? So a lot of times it's just, having different categories and using different bullet points and um, making sure that our most that the highest priority content goes at the top and making sure that we can be as visual as possible, etc. So I will say one quick thing about video that we'll switch over to the Heal Medicare site here, but you'll see these a lot, these kind of quick 60-second or so, 30-second introductory videos. You see them on campaign websites a lot. You see them on, all sorts of websites. But it's really quite important to subtitle them. So, and YouTube subtitles they're not terrible. They'll capture the essence of what somebody is saying. But uh, they're not as eye-catching as, subtitles that you would add in manually. So I'll just play this really quickly and I'll mute it. But you can see, you know, um, having these is important. It's a little bit more labor intensive, but there are tools to be able to put these in. And I'd really encourage, like, especially if you're developing a 45, 60-second video that's going to be your first impression on your homepage, uh, subtitles are a really important part of that. Visually speaking, and also because I think a lot of people will be looking at the site and will not have their volume on. So that's mostly like a social media recommendation, that if you're putting videos on social media, you want subtitles because people won't have their volume on. And I think the numbers for that, the last time I saw it, it's at least 90% of people who do not have volume on as they're scrolling through their news feeds. And I'm sure it's higher than that. But yeah, something else to keep in mind.
I guess I was just wondering, um, what you suggest we do for just like beginners just who want to get practice, I guess. Like, well, should we just go on, I don't know, Squarespace and kind of play around, or what would you say?
I think so, yeah. So I would say when we were putting the Heal Medicare site together, and even when we relaunched the PNHP site, which was a number of years ago at this point, just doing a simple sitemap is a really good place to start. So think about if you are on WordPress or if you're on Wix or whatever other platform, um, think about what you want to say on your homepage. And then think about what you might want to go into more depth on that might warrant an interior page. So I think mapping it out at the outset makes a lot of sense. At least that's been my approach. Also, when we've done our sites at PNHP, especially when we're putting them together at the beginning, but even as we're creating new pages, like it's a very collaborative process with other members of the staff. So the harms report page that I showed you, that was something that my colleague at the time, Gaurav, was writing up and researching. It's something that all of us on staff were doing interviews with people for those video clips. It's something that I was working on editing, and it's something that we all talked about, like what do we want to feature? How do we want this to be organized? Are there any other like calls to action that we want on the page? Where do we want this positioned on the website? So that's not something that the web developer just decides on their own. That's something that everybody who is invested in whatever the project is ought to have some say on. And maybe, they don't necessarily need to weigh in on technical questions, but it's good to think about, like, what do we want to communicate? What do we want to prioritize? What actions do we want people to take? And if you're able to have that conversation with everybody who ought to be at the table, then you can take all of that as a site developer and incorporate that into your design. But to answer your initial question, absolutely, like playing around with the whatever tools you have at your disposal um is the way to go, because the a big defining feature of websites is they are not static. So you're going to be changing things, and you should feel free to change and update things on a regular basis. So yeah, mess around with stuff and see what works and what doesn't.
I have a follow-up to Caitlin's question because I'm also in the beginning stages, but you mentioned like a few different website builders like Elementor and WordPress, but between those, or if you have any others, like if we wanted to do something like a little more than Squarespace, like which should we go to, which would be more like beginner friendly?
Yeah, so I do think Elementor is a little bit more advanced because it's a plugin for WordPress. Um, it took me a second to familiarize myself with it. They all have their own sort of quirks. I do feel like Wix and Squarespace are user-friendly enough that I think, if people are, kind of familiar with, um, with sort of basic website layout and grammar, that you're going to be able to put something together. And there are tutorials for all of these as well. I haven't used it yet, but Canva may have a website builder in it.
What's
And
the name?
Canva.
Oh.
And Canva's pretty like intentionally um they do a lot of hand holding and directing of folks. I like Canva a lot for design. Like I use it quite a bit. So you can go in whatever direction you like. Don't I don't know off the top of my head if Canva has site building capacity, but if they do, that might be something to look at. But if you're just looking at kind of putting content into an existing template, like, looking at WordPress and just seeing what they have available for templates and picking something that looks good, that's totally fine. And if it's something that's like quick and you just have a few things that you want to communicate, I think, a link tree or a Substack are good options too, because, at that point you're just sort of, picking a few images that you might want, and, maybe messing around with some color schemes here and there. But you're not going to be doing really intensive page building. So I'd encourage people to explore that as well.
Thank you.
Mhm.
I have a couple questions if other interns don't have them right this second, but if you do, go ahead first. So one question I had is, for instance, we're always working to try to get our recordings accessible to SNAP members across the country, not just during our internship. I think we're getting closer. Every year we get a little closer. But how do you decide, like, what's your thought process and what would you recommend for where to put them and have them be the most accessible and have it be relatively easy for you to do? Like just putting them on YouTube, like you said, like you have to drive people there. No, people would never know that they're there, right? So you want to have them somewhere on our website. Do you put them on the Vermont page, but then who knows to go to Vermont to look for it, right? Do you put them on the Snap page? It seems like Snap page is a little bit hidden, and it could be any activist. It doesn't have to be students who are in Snap,
Yeah.
So one question is like, where do you link it in? And then like, what does it look like as far as like how many clicks and this and that,
Yeah. So I think, so having a dedicated YouTube playlist, which I know the internship program has, for a number of years,
Which
separate.
I didn't know that.
Yeah. So that, that's good. I think, from what I know of the volume of sessions that you all do, there's a lot, right?
Yeah. Yep.
So I think if it were a web page, like we're seeing this video of Dr. Weisbart embedded on the Heal Medicare site, right? This is the one video that we have on our homepage. And there are some internal pages where we have videos embedded as well, but there are going to be like two at most.
Yeah. I was picturing more that there would be links on the page, but how do you make it look attractive and have it be findable and everything? I was assuming that they would be on YouTube, and then there'd be a link to each different one, and we have to figure out how do we want to organize them so people could know like which one do we watch, where do we start?
Yeah. So if I'm thinking about like what does an internship archive webpage look like, I probably would recommend directly embedding a few very high level sessions at the top, so people can see the biggest priority ones that you have. You could maybe do that by category. So if you have videos on Medicare Advantage, for example, maybe take uh, the one that you want to highlight the most and embed that. And underneath that, you could have a bullet pointed list that links to the others. And then you could do, similar, a similar set up for other topics. But in terms of placement on the site, I think, it goes back to, how do you want, it goes back to needing to drive people there, right? And that's going to happen outside of the site. So I know there's the annual application process, and so, you may want students to see archive videos, or at least to see the ones you really want to feature during that process, so they can, kind of get a flavor for the internship program, or learn whatever, you most want to pass along. It may be at the, start of the internship program or during the program, where you want to make archived material available to students so they can see, and then at that point, as part of a syllabus.
Yeah.
And really, I mean, that can be in a Google Doc, right? So it all depends on how, I think there's the necessity to drive people to that page.
Right.
I don't think I don't think there would be a large number of people who would land on that page. The exception being, like, maybe during the application process, as people are learning about the internship program and researching it and deciding if they want to apply. I think there's an opportunity there to highlight some of the archive sessions and say, check this out, and you can see
Mhm.
what this program is all about.
Okay, so I can ask you more questions on that later, so I'm not taking up too much of the intern's time, but another functional kind of question is, so you, on the PNHP website, the chapters, when you click on the map on the different states,
Yep.
you can see, if they have a website, you can see actually the link to their website. If they don't, then you can maybe see the link to some local speakers or who their chapter president is or whatever like that. And like, I don't know how many of them, because I haven't like clicked through them all. I don't know how many of them have pages like ours. Like the Vermont chapter actually has a few pages of our own. And intermittently, I send you things to update them. Do any of the Snap chapters do that?
The SNAP chapters do not. So chapters in other states do that. SNAP does have its own separate site, so I'll just click over there because I neglected to do that
Okay.
at the beginning. But this is a WordPress site, and the SNAP.
You want to share again?
Oh, am I not sharing?
You're not sharing right now.
I
Okay.
can see it.
Oh, you can? I'm seeing all the faces. Oh, you know what? I bet I accidentally clicked on a button at the top that moved it away. Okay, got it. Thank you.
So this is very much like a blog site. It's kind of like a standard WordPress site. And so recent posts here on the left are the most current things that the Snap Media team has added here. And then there's just like an introduction to Snap here. They manage their own map of chapters, and just to kind of roll over here, like you can see they'll have chapter contact info. I like that they put the congressional district. That's great. But yes, so Snap manages this on their own. And yeah.
So if any of our interns were interested in volunteering on the media team, what kinds of things would you tell them they would be doing if they were on it, and what might they want to learn about or whatever? Can you talk about the media team a little bit?
Sure. So Snap leadership is organized to turn over once a year around graduation time. So at that point, earlier in the spring, they have an application process for people to apply for Snap leadership. And you can see in here about us. There we go. Leadership teams. So executive board, there is an executive board, there's an infrastructure committee, education, political advocacy, there's a bunch. Media is here as well. So every spring they put out a call for submissions to sign up for Snap Leadership next year. They ask people to, yeah, there's like a Google form where people apply and indicate, their interest in Snap and in single payer and in what committees they might be interested in serving on. Um, and then the Snap leadership for the year will look through all of those and make decisions about, who's going to be on leadership for the coming year. And in general, I think if people apply to for Snap leadership, there will be a role for them in some capacity, right? It might not be on an official committee. It might be in chapter leadership. Um, but I think everybody who fills out the form will be encouraged and will have the ability to contribute as a Snap leader for the coming year. And I think it's in May, I believe, when that happens, when the new leadership teams come on board. So
Yeah, I think Lori said they might do it a little bit earlier, so there's a little bit more opportunity for, crossing of communication between the old team and the new team.
yeah,
So I see on here, and I think a couple of the other teams also say maximum of 4 total. And I find that interesting because I've heard, and I don't remember if I heard it from you or from some other advocacy place, but when you have volunteers, not like paid people who are, that's their job. But when you have volunteers, it's good to have a team of 4 people for each social media thing. So that you can stay, keep things looking fresh. When you're busy activists, they're only volunteering part-time. And I would think with medical students, you'd need at least that. And so like, does this media team have other people that work for them? Or how do they stay updated while they're medical students? Like my suspicion is that they don't keep up even with just Facebook, much less doing multiple platforms. Like when I looked a year ago or so, the Facebook was way behind and I haven't looked more recently. This page is updated compared to, for a long time, it was kind of dormant, but this is much better right now.
yeah. I mean, the simple answer to that is that, a lot of times their schedules will preclude being
So why only 4 people? Why wouldn't it be more? Why wouldn't it be like 4 per platform and then 4 more for the web page or whatever?
yeah. I mean, it says 4 maximum. There are more than 4 on the media committee right now.
Uh-huh.
So, again, I think like I don't know why it says that on the site, but I don't think there is. Snap leadership over the years has expanded. So there are more people on committees this year than there were last year. There were more last year than there were the year before. That's true of the executive board and of, I think most every committee that that's within Snap. So yeah, I don't think they're not in the habit of turning away people who are interested and want to dig in on stuff. And I think even like during the course of the year, if anybody wants to kind of connect with the Snap Media team, I know I mentioned the schedule earlier, but um, you know, I'm sure that the Snap Media team would be happy to, chat with folks who are interested in doing any kind of communications work. So whether that's social media or website design or or internal communications, et cetera, et cetera.
Mhm.
You know, the,
That's good to know. It'd be helpful maybe to have that be more obviously welcoming on that page, because for instance, a lot of medical students won't even have heard of PNHP before May. Some of
Mhm.
them are starting to hear between January and, you know, during that period when we're putting out our recruitment applications and, you know, I don't know how many other major efforts there are to get them in the newsletter to, you know, all the medical students coming in. But
Yeah.
if they don't hear about it until May, and then they've missed or even they don't hear about it until September of their sophomore year, of their second year, then by the time they can apply the following May, they're heading into clinicals and they're too busy to do it. You know?
Yeah, and I think like I would defer to Lori on kind of the specifics, who's our national SNAP organizer, of like what we look for in terms of engaging students. I think at the outset, a lot of what we encourage people to do is at the chapter level. Um, and then, if they've been active at the chapter level for a period of time, then um, then maybe applying for a committee for leadership when that application comes up again makes sense. But on a individual basis, right, it might just so happen that somebody is active at the chapter level and builds a really great like Instagram presence for their local Snap chapter, and does some interesting and innovative stuff that catches people's eye. Um, and at that point, like there's no reason that we are not going to connect that person with the national Snap Media team prior to the formal application process. And we'll certainly, encourage them to apply for to be officially be a part of the committee when the time is right. But yeah, I think it depends on where a student is and like what their interests are. But I think in general, we encourage people to sort of get active at the chapter level.
Thank you. Thank you. What other questions do people have? We take a look at what we had put in the
Is anyone curious to
Sure.
know what Elementor looks like on the back end?
Sure.
Okay, I can log into that. All right, so this is the Heal Medicare site, which I mentioned is in WordPress, but uses a plugin called Elementor. So this is the WordPress backend, and you can see that there's our media library, there's the different pages that we've built, and there's different ways that you can sort of tweak your themes, your settings, your menus, all of that stuff. But just to show you an example of a specific page, these are all of our existing pages. Let me go to this one that we put together for the Dr. Oz shadow hearing. So you can see I'm hovering over it and it gives me all these options. And one of them is edit with Elementor, which is how these pages are built. If I just go to edit, this is what sort of a standard WordPress page would look like. And this box here is where you would do all of your site updates. So you would put in your text and your images and your embedded videos in here. But since we're using Elementor, the only thing here is an option to edit with Elementor. So when we click on that, then it brings up Elementor. I'll stretch this out a little bit. But you can see that what this basically is boxes stacked on top of boxes, right? So this is a video box, and this is a text box, and this is a text box, right? And this is a text box with a different color background. And you can have dividers, you can have buttons with links. So basically you're going to grab anything from the left here, and just drag it in place, right? So if you want to have an image here, you're going to drag it to wherever you want. And you can go in and click this edit button. And that brings up these options on the left. You can choose your image. It's essentially you'll be able to choose from whatever you have uploaded to your media library. You can upload new files if you like. And let's just say we really want this image in here, and it just pops up, right? You can change the image resolution, et cetera, right? You can link. So all of that is, is pretty self-explanatory as you're kind of looking through those options. You can also right click on here, and we don't actually want this, so we can delete it. And if you're on a video, it's one of the nice things is all you have to do is put the YouTube link. You don't even have to put the embed code. But yeah, and then if you are looking at these boxes, I'll just click on this text box to show you. So you can do any editing in here. So there's going to be a content option. There's also going to be a style option. So you can do things like alignment. You can change the paragraph spacing. You can change the text color, the font, etc. And then for advanced, you can do things like play with the margins. So if you decide that you want more space between this and the next element, you can just say, instead of making this 6, let's make that 24, right? And change things that way. So again, something to kind of play around with. And that is a very basic run through of Elementor, but it's similar to things like Wix and things like Squarespace. You can also go in and adjust global settings, site settings in here. Global colors, global fonts, all that stuff, right? So something to if you're interested in exploring, just kind of mess around with stuff. I'll mention one thing really quickly that I haven't said, but as you're putting together your sitemap and as you're thinking about like what you want your website to communicate, and how you want to get it out to people, I think something else to think about is how you want your website to stay current. So, we have a lot of categories on the PNHP site, for example, that are built to be regularly updated, right? Like this news ticker here in the middle, We update that every time we have a member who's written something or quoted in the news. We're going to add, add that here. But it's, I think it's good to, especially if you're thinking about a campaign-focused website, like the Seal Medicare site is, just to think about like prioritization and not letting things get too unwieldy. So the Heal Medicare site started when we had a campaign that was focused on Medicare direct contracting, which morphed into a program called ACO Reach. And that was, eventually capped by the Biden administration. But for a number of years, we were talking about Medicare direct contracting and ACO Reach before we started talking more intensively about Medicare Advantage. So everything that was that we were talking about there is in this stop reach page. And you can see this is archival. I apologize that for whatever reason, the embedded videos do not show up when I'm logged into WordPress. But there's a nice video here. And then you can see all of these pages, right, are bullet pointed here. This is basically the old site, right? So these are the menus and the pages that we had. So this is archival, right? And people can look at this and see, what we've done if they're looking for, you know, uh, documents from before, if they're looking for an old live stream, if they're looking for an old one pager, or just information about the REACH program. But once we kind of transitioned the nature of the campaign to be more focused on Medicare Advantage, we transitioned the website as well. So I think building that into your planning, obviously you're going to be responding to things and you can't anticipate everything. But I think it's good to keep in the back of your mind for sure, and to plan as much as possible for, what do we anticipate the website looking like a month after launch or 6 months after launch? What are things that we know we're going to need to update so the site doesn't get stale, and put that in a calendar? And what are things that we might conceivably want to add to the site as we, as we move through time. So that's a crucial part of it as well. Oh, Betty, I think you're muted.
All right. So do you specifically like you did that Medicare Heal Medicare page, and as news changed, it comes out that they're gonna, not do any more enrollment for DCEs, and then they're gonna change the name. So as those things come out, you make decisions, but you also don't, you want to check it every so often and make sure that things didn't go stale that you forgot about. So you just put something on your like work calendar, like check it in a month or something.
Yeah, I think as you're making website updates, if you're putting something in that is going to be dated at some point, then yes, put that in your calendar and say like, you know, um, this is something that we need to update on such and such a date.
Of course, there are things you don't know are going to be dated when you put them up. Like
Yeah.
so many things have happened since January that we were not predicting, or at least we weren't knowing before November.
Yeah. And that's just, I mean, the nature of advocacy is that things are always very fluid, right? So, um, you know, and but to the extent to which you are setting your own advocacy agenda, which I think is always valuable. You know, you can plan for kind of what you want, how you want the site to grow and what you want the site to be posting and how you want it to be changing on a regular basis. So I think you can plan for and anticipate some of that, but absolutely you'll need to roll with the punches on things. And then, you know, it's good to periodically, especially if you have a smaller site, you know, do a detailed site audit. And even if it's just a spot check to see like, are there things in here that you know, that are dated that we should either you know, delete entirely or, you know, move or reword or what have you. So that the Dr. Oz shadow hearing page that I showed earlier, you know, as we were in the run up to that shadow hearing, we were using it to encourage people to register, right? So we had the registration link on it, and we had the embedded live stream, but it said, you know, coming soon. Um, and and then once the live stream happened, it was archived on there, but we knew that all throughout that process, that was sort of a living document, if you will, and we were making changes to reflect what was happening at any given point in time. And we knew that after the live stream was done, we would have, you know, certain things that were calls to action. And we knew that at some point, some of those were going to be dated because it was saying, you know, sign up for this thing that's happening in 2 weeks. Well, once that happens, we have to take that off, or we have to put a link to, you know,
Recording.
yeah, all of that. So
Yeah, yeah. Jay, did you have any specific questions or concerns you wanted to raise while we have Dixon's attention here?
I was curious about something that one of us brought up earlier, I think, um, about the utility of using or creating a website like we were shown just now versus exploring something like Substack or another medium. I'll just ask the question directly, I guess. Thank you for your time, Dixon. I was chatting with one of my classmates who had an idea about creating a platform for us in medical school to write and just not publish in a sense. I mean, casually publish, not in a like peer-reviewed sense, but encourage students to write with a, you know, having a medium that's kind of easy to access just among students, shared among us, for us. And in that, he was exploring his a website and thinking about using that as a platform to then just open to students in some sort of way, which he hadn't really figured out yet. And I had suggested maybe something like Substack, which is already a built created platform just for written medium, would be more accessible. And just, I mean, from your experience managing these systems and dealing with people pulling content toward this page that you're managing, what do you think is a good way to go about that, a project like that in which you may have, you know, more than 100 students, maybe more like 50 or so, contributing to this at one point or another?
yeah, I mean, I think Substack or, you know, other you know, similar platforms are, you know, there's yes, people should use that, right? So I don't think anybody should let you know, sort of the intricacies of website development or like creating a site on a platform like WordPress be a barrier for them. So if they want to use you know, a tool that's templated, if they want to use a tool that's free, right? Because that's another part of this. You know, some of these have costs. So, yeah, if anything that's a barrier to kind of like putting content that people are eager to post up, um, people should sidestep that, right? I would definitely encourage people to do that. And I think at that point, and even, then another question is like, it stems from kind of what do you want to post and what do you want people to do, um, once they see it, and how do you want to get it out to people? Um, and so social media platforms are also an option for that, right? You're going to have less ability to kind of like go through and navigate those than you would a traditional website, or a blogging platform, or a link tree, because that's all yours and there's not other distractions, right? Um, but uh, but yeah, I think any and all of those online platforms are good options. And if somebody wants to take a look at a Substack or a Medium account, or anything similar, uh, if they feel comfortable with that, and they feel like they have something regularly to say, as if there's a group of people who feel that way, uh, then that's what they should do. The only thing I'd suggest is, to think about um, how they want to uh, drive traffic to that page. Um, and if there's a number of people who will be writing for it, like I'd really encourage them all to take ownership of promoting that page as well, right?
Mm.
So writing for it is half of their responsibility, and the other half is, you know, uh, sending it out to everybody that they know and everybody that they think should see what they put up.
Thank you for that. And just as a really quick follow-up, to, as you mentioned, to getting people, collecting people's writing in this way, if we put this out as an idea and invite people to write for this, what would you suggest is a intelligent way to collect people's work? Something like a Google Doc form, or is there, I don't know, a more should there be something more professional or secure? Is that necessary?
I mean, Google Docs works.
Okay, great.
Yeah. Depending, I would recommend having one person be
Mm,
the person who manages the actual platform, um, just for the sake of consistency. Uh, but but yeah, and I'd also recommend having a consistent form for or a consistent tool for submissions. So if it's
mm,
Google Docs for in general, like it should be Google Docs for everybody.
got
Um,
it.
but yeah, so I'd recommend consistency across um, you know, users, but and contributors. But I think having and that can also extend to like uh maybe like a quick style guide, um, you know, a sort of basic rules for the road.
Mm,
You don't want to be too prescriptive about that. But like some overall, formatting things, and also statements of, like what is the purpose of this thing? What are the unifying, you know, themes that we're trying to hit? What are overriding values? What are things we don't want to do? Etc.
So I wanted to point out that it's after 5 in Eastern time, and Dixon had said that he might be able to be available until 5:30 our time, but you folks may have other commitments. We've already had 2 head off. So is there anything that anybody really wanted to ask that they have not had an opportunity to ask yet? Nope. Okay. Okay, so thank you so much. Really appreciate your time walking us through that and all. Gosh, I guess I had a question for Lauren and Trinity, but we already lost Trinity. So Lauren, what was your thinking about what you wanted to do? Like you wanted to find out a little bit more about like how to choose these different things. Is there a particular nonprofit that you're planning on working with, or you've already been engaged with and that was a team that you had questions with? Or like what would be the next thing you would need mentoring in or support for or whatever?
Yeah, I didn't really have like a specific cause in mind.
Okay.
But I think after listening to Dixon, what I think I probably would want the most help with would be like better outreach via social media. Since he did mention that that's like the best way to get people to actually go to see what's on your website. Even if your website is organized really well, you need people to actually go to it to
Yeah.
get the message out there. So I feel like that's probably my next goal. Just thinking about what are ways I can get people's attention. Yeah.
So that sounded a little bit garbled from my side, but I think what you were saying is that you are looking right now also more at how to drive people to a website before you worry about making the website.
Yeah.
Yeah, okay. Okay, great. Okay, well, thank you so much. Appreciate your time, Dixon. Very helpful.
Thank
Sounds
you
great.
very much.
Thank you.
Thank you.